Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is also being interpreted in American Sign Language by Kim Rich, and Carlos Saraceda is interpreting the press conference in Spanish, and his interpretation will also be available on the county's webpage and YouTube page shortly after we conclude the press conference. As I'm sure you already know, Governor Newsom did not issue a statewide closure of all beaches. He announced yesterday that only beaches in Orange County will be closed by his order. Beaches in Santa Barbara County will be open, but visitors must practice strict social distancing. I know this is good news to many local residents who enjoy our beautiful beaches and rely upon beach walks to relieve the stress and anxiety that builds up while staying home. I'm one of those people. Last Saturday morning, I walked from Shoreline Park to Henry's Beach at 6:30 in the morning. The tide was out. It was extraordinarily beautiful. I wore a mask and was very careful to stay away from other people. Since it was so early, there were very few people on the beach and it was safe. We all treasure our local beaches and have a deep connection to the ocean. That connection shouldn't be closed during this pandemic, but going to the beach also can't be business as usual. As the governor explained, we're still at a critical phase when the virus can spread rapidly if too many people gather together in one place. Governor Newsom said it very clearly at his Monday press conference. This virus doesn't take the weekends off. This virus doesn't go home because it's a beautiful sunny day around our coasts. Governor Newsom was also careful to acknowledge the local efforts that he expects to be followed all across the state of California. He noted beaches outside of Orange County largely abided by the state's orders. Governor Newsom stressed that until a vaccine is distributed, the virus is still a threat. Until then, we have to manage it, we have to manage risks, we have to manage and augment our behavior, he said. That's why he said he could not impress more to those of us in California that watching those images like we saw, particularly on Saturday in Newport Beach and elsewhere, is not acceptable. Local law enforcement will be out in force in Santa Barbara County this weekend to keep our beaches safe. The Sheriff's Department will have deputies mounted on horses and all-terrain vehicles patrolling the beaches from Gaviota to Rincon. Sheriff deputies will make contacts with groups and explain it's necessary to keep physical distancing even when outdoors. The California Highway Patrol is also increasing its enforcement units and will be focused on ticketing illegal parking violations near beaches. County lifeguards and park rangers will again be assisting with outreach and education at Arroyoboro and Goleta beaches. Our parks and beaches can only remain open if people keep a safe distance from each other. Our local cities are also stepping up by increasing staff presence at beaches and parks, promoting the importance of physical distancing, and conducting parking enforcement to prevent overcrowding and minimize disruptions to neighborhoods. Like last weekend, there continues to be a lot of collaborative, proactive work done by all the local agencies across the South Coast to anticipate and control crowds at local beaches. The most important ingredient in the equation remains individuals taking personal responsibility to make good decisions. Each of us can help solve any issues by avoiding beaches on the weekend and during the afternoons when it's busy. There are so many other ways to get exercise and relaxation. Let's all work together to keep all of us healthy and safe. The coronavirus pandemic has been extremely disruptive to our daily lives and our economy. Almost no one anticipated the depth and breadth of the challenge this public health emergency represents. We've all sacrificed a great deal, and unfortunately, that sacrifice is not over. The circumstances are very difficult, and much is beyond our control. How we choose to respond to this challenge is fully within our power. We can each decide how to face what is being asked of us. We can focus on the negative and get angry and frustrated and lash out, or we can be calm and carry on. I know it's getting harder, but I continue to be proud of how our community is taking this crisis in stride and pulling together. I'd like to highlight the work of some local organizations that are promoting healthy outdoor activities during this time. The Wilderness Youth Project exists to foster confidence, health, and lifelong love of learning for young people and families through active outdoor experiences and mentoring. Although COVID-19 presents the Wilderness Youth Project from providing in-person programs, they have moved many of their programs online. Their Nature Link virtual mentoring program provides youth with weekly group activities online. Children have the opportunity to connect with each other in a guided discussion and are given individual activities to complete in nature. From spending time in parks and open spaces to spending time in one's neighborhood, there are lots of safe outdoor activities that kids can enjoy during this time. The Santa Barbara County Trails Council continues to help maintain our local trails, while also promoting how community members can hike responsibly while preventing the spread of COVID-19. Earlier this week, the Trails Council promoted Parks RX Day, which promotes regular outdoor activity as a prescription to improve individual health. The Isla Vista Recreation and Park District has been conducting the 6 Feet Apart but Together at Hart campaign, where community members share photos of themselves enjoying Isla Vista while practicing physical distancing. Thank you to all the organizations that are working to promote the safe enjoyment of our outdoors. I'd now like to introduce Dr. Henning Ansorg, the county's public health officer.
Thank you, Supervisor Hart. Good afternoon, everyone. Let me give you today's case numbers. We are reporting 10 new cases today in Santa Barbara County. We now have a total of 506 cases. 60 of them are recovering at home. 36 are hospitalized, with 14 in the intensive care unit. We are pleased to share that 389 people have fully recovered. Unfortunately, 8 have died. More information and details can be found on our website at publichealthsbc.org. We understand that outdoor exercise and recreational activities are very important for our overall health. I'm sure that everyone in Santa Barbara County was relieved to hear that we continue to be able to enjoy our beaches, trails, and parks for recreational exercise activities. As a community, we need to make sure that these activities do not pose an unwanted risk of spreading the virus. For the most part, county residents have shown that this is quite possible. The Public Health Department continues to support these activities because they are essential for maintaining good overall health, especially during otherwise stressful times like this. We are working diligently on preparing for the upcoming transition phase. As you know, testing needs to be widely available and accessible in order for this to become a reality. We were pleased to share in a press release earlier today that the first 3 testing sites in the county, the first of 3, is opening as early as this coming Tuesday, May 5th, at the Santa Maria Fair Park. Additional sites will come online later next week in the city of Santa Barbara and in the city of Lompoc. Locations will be announced as they are known. These testing sites will be operated by a company called OptumServe, a contractor of the state of California. Screening and testing appointments can be made by visiting lhi.care/COVID testing or by calling 888-634-1123. The test will be free of charge or billed to health insurance where available. Appointments are required for testing. Everyone is eligible to be screened. However, individuals who meet the following conditions will be prioritized: healthcare workers and first responders, persons 65 years and older, or any age with chronic medical problems, residents or employees of congregate care living facilities, persons in essential occupations which include utilities, grocery, food supply, and public employees. Any persons exhibiting one or more symptoms of COVID-19. Again, those folks are prioritized, but everybody can make an appointment. Santa Barbara County is rapidly reaching the threshold of necessary test capacity and contact tracing capacity for COVID-19 positive individuals in order to reach a major milestone for the reopening transition. Public Health is recommending to wear face coverings when going to a store. However, we do not have sufficient scientific evidence to make wearing of these face coverings mandatory at all times. Physical distancing and good hand hygiene have proven to be a very effective tool in preventing further spread, and we encourage everyone to continue with that. Thank you.
Thank you, Dr. Hansberg. We'll now hear from Paige Batson, who will share more information about the County Public Health Department's COVID-19 contact track and trace efforts. Welcome, Paige.
Thank you. As Dr. Hansberg mentioned, we are very, very pleased to collaborate with the state as they stand up their 3 testing sites in the coming week. To support the additional testing results that will be coming over the next few months, we are working to train up to 100 people for various elements of the contact investigation process. These additional staff members will be a mix of county employees from various departments, many of which we are in the midst of training and or will be training. The disease investigation process includes training individuals to conduct contact tracing and contact monitoring. Additionally, the Public Health Department is working with community partners from all parts of the county to engage people who may be interested in filling some of these critical roles. Some of these roles will require us to have individuals with certain credentials, such as nurses, and others will simply require individuals to have very good interviewing skills, communication skills, and so forth. We will also be seeking bilingual persons who can help us with the interviewing. And I'd like to spend some time discussing exactly what contact tracing is and what our community members that test positive can expect. While there are some details that need to be worked out with OptumServe in terms of notifying individuals of their test results, we understand that individuals will be receiving their test results, whether they're negative and or positive. However, positive test results will also receive a call from our public health nursing staff who will initiate the disease investigation process. What the contact tracing process typically looks like is that the individuals will be contacted, notified of their positive test result, and we will begin identifying persons for whom they may have been in contact. In most instances, the identity of the positive case will not be disclosed unless there's a situation where the infectious person may have been in a congregate setting. At that time, we will need to disclose the name. Once the contact is identified, they are provided with information and support to understand the risk of what symptoms to watch for in terms of COVID. And they will be instructed to self-isolate for 14 days after their last exposure to the confirmed case. Contacts will be asked to monitor for symptoms, and if they become ill, they will promptly notify public health staff, at which time public health staff will provide testing. Again, if they test positive for COVID-19, trained staff will connect with them again to repeat the investigation process. Contact tracing saves lives by helping us diagnose people earlier and reduce the chances that COVID-19 will continue to spread. This is a process that our disease control team is very familiar with as we use it in a variety of disease investigations that happen year-round. Thank you.
Thank you, Ms. Batson. I also invited Anne Marie Cameron, who's the Executive Director of the Mental Wellness Center, to join us today because May is Mental Health Awareness Month. For more than 70 years, the Mental Health Wellness Center has been building hope for individuals and families, providing support and raising awareness of mental health within the Santa Barbara community. Thank you for joining us today.
Thank you. Hi, everyone. Good afternoon. I am Anne Marie Cameron, and here today on behalf of the Mental Wellness Center, a local nonprofit that works to meet the needs of those that live with mental illness, helping them achieve their mental wellness. We also provide education programs to youth in schools and the greater community so that mental health needs are addressed sooner and that mental health crises are avoided. And because mental health impacts us all, we partner with the National Alliance on Mental Illness, otherwise known as NAMI, to provide support and education to caregivers and friends of those who live with mental health problems. Today is May the 1st, and every May 1st, the Mental Wellness Center declares that May is Mental Health Month. We celebrate with all of you and the many partner agencies in our community to promote these truths. We celebrate that people, young and old, are resilient. We celebrate that mental health and substance abuse treatment works and that people recover to live a life of mental wellness. And we celebrate and recognize that our human connection is absolutely essential for mental wellness. During this time of physical distancing, human connection can seem hard to achieve. Over these last few weeks, the Mental Wellness Center and NAMI have successfully transitioned from face-to-face services to effective phone and virtual support groups. Those who live with mental illness and their caregiving friends and family have supports available at the Mental Wellness Center. We are also extremely proud to be a partner agency in the Community Wellness Team, which is a group of over a dozen organizations that often meet every morning together to determine what the needs are in our community for mental health and wellness. Our message from the Community Wellness Team to you is that you are not alone. And we mean it. There are dozens and dozens of caring organizations and people that are available to take your calls, to make return calls, and to be a source of support to you when you are struggling. The phone number for the Community Wellness Team is area code 805-364-2750. And if you'd like to learn more about the resources for adults living with mental illness and caregiving families, you can visit the Mental Wellness Center at mentalwellnesscenteraltogether.org. Thank you.
Thank you, Anne Marie, and thank you to all of the staff and board and volunteers at the Mental Wellness Center who are doing such critical work helping individuals and families on their path to mental wellness.
Thank you.
We've been working together on this issue for more than 30 years.
More than 30 years.
Since you joined the organization as a teenager, right?
As I was right out of high school.
Thank you. We'll now go to questions from the room. Mr. Fish.
Yes, Dr. Ansler, you talked a little bit about the new daily testing sites. Wanted to know if you knew the expected daily testing capacity for each one of those sites, and also how much those will help the county get to those testing milestones you talked about that we need to reach before we begin reopening the economy.
Yeah, thank you for your question. We are anticipating to run around 100 to 130 tests per site per day. The sites will be open 5 days a week. So we will, our target goal is anywhere between 500 to 650 a day availability. And I think with our capacity at the hospitals, at certain clinics, urgent care centers and so forth, we should be there once these testing sites are up and running.
So just to follow up on that, once these sites are then up and running and we reach those numbers, what will that mean for the transition phase that you're preparing for now?
We have to have the contact tracing in place, of course, and that is the second leg, so to speak, of the testing capability. And having the testing and tracing in place is one of the milestones that Governor Newsom and the State Health Department have proposed as the roadmap for transitioning into the next phase. It's one of the major milestones.
And then just one more unrelated question. Wanted to know, this is for anybody who may have an update on the Lompoc prison outbreak. I know 2 weeks ago, Nick Clay was here and said the medical facility they were working on site was looking like it would be completed within 2 weeks, and we've reached that now. So just wanted to see what the update is in terms of that medical facility and the numbers there trying to contain the outbreak.
I'll answer that. We do not have an update on the medical facility, but we have been working with them very closely in terms of reporting new cases and them meeting the reporting requirements. So we've been working closely.
Any other questions in the room? We'll go to the phones next.
Yes, we have a couple. Tom Bolton with Newshawk. You're up first. Go ahead.
All right, thank you. I have two questions today. The first is a follow-up on the prison. Can you give us a sense of what progress has been made in controlling the outbreak at the prison? I see there's no cases reported today, but I think people would be curious to know how much progress has been made.
What I do know is that they are working very, very diligently to maximize their testing and mitigate their infection control measures.
But you don't know whether they've succeeded, I guess is my question.
No, the only thing I can base it on is their reporting that they are doing as required and as we monitor their daily new case rates.
Okay, thank you. My other question pertains, I'm wondering where things stand in terms of developing specific demographic information for ethnic, racial, gender breakdowns of the various cases, and when we might expect to get that information.
I expect that will be forthcoming in the next week or so.
Okay, will it be broken down by area?
That is the plan to look at. As currently, we are tracking all of those indicators that you're speaking of, and we do anticipate that we will be able to share that in the next week or so.
Okay, thank you very much.
Thank you,
Thank
Tom.
you, Tom. Up next is Reza with San Ynez Valley Star.
Hi, everybody. I am wondering, I don't know who would have the answer to this question, but about summer camps as we're getting into summer and once the restrictions are lifted in a few weeks, supposedly, is there going to be summer camps? And two, I wanted to know if there's any update to serology testing in Santa Barbara County.
Yeah, I can speak to that. Thank you for your question, Risa. With regard to the summer camps, we actually had a discussion today with the school boards and about what requirements the schools have to fulfill to prepare for the upcoming opening. And the schools play a major role in the roadmap to reopening the state, and they will be opening up with the first other business sectors. And unfortunately, we cannot give an exact timeline. However, once we start opening up in alignment with the state, there is the possibility for summer camp activity. There is also talk about starting the school year earlier this year in order to make up for learning gaps that have occurred while schools were closed. So I hope that helps a little bit to answer that question.
Yes, however, I'm hearing from some teachers that are part of the teacher unions that they're not excited about that possibility of doing sooner school. So I don't know how that would look, but have you guys heard from teacher unions here?
I think that's a question for the school districts, and they will have to be working with the teachers union through the collective bargaining process to come to a resolution of those issues.
Okay, and regarding the serology tests, have those had any progress in the last week or so?
Yes, there are more tests FDA approved by now. Having said that, the serology test is still absolutely not ready for prime time. It is a very good scientific tool to measure how many people have gotten in contact with this virus. It is not a diagnostic test. So the only
Right.
diagnostic test we have is really this nasal swab where we check for actual virus material and not a blood test where we check for the antibody against the virus. So unfortunately, the antibody test will remain a really vague measure until we have very solid evidence of the antibodies actually being able to refer immunity. And that will only be able to be determined probably late in the fall, unfortunately. But it takes that long to monitor this and do some studies on it.
Okay, thank you.
Thank you,
That is all
Raisa.
the questions that we have.
Thank you. Our next press conference will be held Monday at 4:30 p.m. Please continue to follow these 3 simple steps that are now a regular part of our daily lives. Please stay home as much as possible. When you go out, wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands, don't touch your face, and disinfect surfaces regularly. And number 3, if you feel sick, isolate yourself at home. If your symptoms worsen, call your doctor or your clinic and follow their medical advice. Thank you very much for joining us today.